So there are really two main areas where the rubber meets the road on a disability insurance policy. The first is with the definition of total disability, and the second is with partial or residual disability. Those terms are interchangeable. Now with total disability, there's kind of a spectrum. So on the more liberal or all-encompassing side is the true own occupation definition. And this covers you if you're unable to do the substantial material duties of your regular occupation. So you can think of a doctor or a dentist. You can no longer perform surgery or do, dental hygiene practices. Then you would then be able to claim on that definition, even if you could do a myriad of other things. The next step down would be a modified own-oc definition, or we sometimes like to refer to it as a basic own occupation definition, which essentially reads very similarly to that true own occupation definition, just going to add a few extra words at the end. So you're considered disabled if due to injury or illness, you're no longer able to do the substantial material duties of your regular occupation and not working elsewhere. So that's kind of key. If you are working elsewhere, then it would go to a partial disability or residual disability definition. But if you're unable to do your regular job and you're focusing, head down on recovery and not working elsewhere, you get paid the total benefit. That's the idea. And then that third definition, this is the one that we see a lot in group contracts. In fact, it's pretty ubiquitous in the group world, which is a true own occupation definition for 2, 3, sometimes 5 years. Very rarely it goes all the way to age 65 or age 67, but usually for a short period of time, it's going to be that own occupation, that true own occupation definition, followed by an any occupation definition. And that basically reads, if you're unable to do the substantial material duties of any occupation, essentially you got to be out of the workforce in order to claim on in a group setting. So some really key important language there, knowing the difference between true own occupation, which is the very best type of definition in the disability world, basic own-oc, which is suitable for virtually all occupations outside of medical and maybe some legal professions. But most office workers, you're going to be fine with a basic own-oc definition, depending on some nuance there, of course. So always important to work with the specialist. And then that third tier, which is the true own-oc for a couple years, and then any oc thereafter, is going to make sure that you're not getting any benefits unless you're totally on your back and out of the workforce.